A BC nonprofit is calling on Metro Vancouver to shut down its waste burning operation in Burnaby. Zero Waste B.C. says that facility's incineration approach to waste management is costly and pollutes the air. Now, the Canadian Association of Physicians for the Environment B.C. is one of several environmental groups joining that call. Our medical columnist, Dr. Melissa Lem, is the president of CAPE. We appreciate you being here, Dr. Lem. What's the major concern here with the incinerator?
Well, this is a really complex issue that brings together the need for energy generation, landfill capacity, and air pollution. But from a purely human health perspective, burning garbage and waste is a very polluting way to generate energy. And if we're going to be investing in upgrading our energy systems, those investments should be in renewable and clean energy that doesn't harm human health.
So, according to Health Canada, it says the biggest source of dioxins in the country is the large-scale burning of municipal and medical waste. Remind us, what are dioxins and how do they affect us?
Well, dioxins are generated when we burn substances that contain carbon and chlorine, and they're part of this overall umbrella of chemicals known as persistent organic pollutants. And the reason is that they accumulate and last in the environment and our bodies when we're exposed to them. And the problem is that when we're exposed to them, they can lead to all kinds of different health issues like immune function issues, liver dysfunction, and certain kinds of cancer.
What about, do they affect people in different ways, for example, men and women?
Well, they are known to be hormone disruptors, and so they can cause women's health issues like irregular periods, early menopause, infertility, and birth defects, and in some cases lead to breast cancer. But really the impact has to do with how much you're exposed to, the method of exposure, what other chemicals you're exposed to with it. And something we need to remember is when you smell or see something burning, so whether it's cigarette smoke or natural gas in your stove or wood or industrial pollution or even forest fires, typically dioxins are being generated.
What if, for example, somebody that doesn't live very close to this incinerator? Is proximity an issue here in terms of they're not going to be affected versus somebody else who's closer?
Absolutely. The closer you are to this waste generation facility, the more you are affected. And this is something that CAPE is really focused on. So we are an organization that is composed of volunteer physicians, and our mission is to protect human health by protecting the planet. And we really focus in on this fact that only about 20% of our health status comes from what we do in the healthcare system. The other 80% depend on factors like our life, like our biology, the environment, and genetics. And when we don't have clean air, clean water to drink, or a safe climate to live in, then these systems that support our health and our healthcare system start to break down.
What about, you mentioned energy generation in BC moving to more electrification. Is that the only solution you see in terms of shutting this thing down and losing whatever power it was generating?
Again, it's a very complex issue because the question is, what will this energy and waste burning plant be replaced with? And we know that the International Energy Agency has said that we cannot invest in more fossil fuel projects if we want to keep global warming to a livable amount. So we really have to look at this issue in a dedicated way and make sure that we're choosing the cleanest and the most efficient way of generating energy possible.
Right. Dr. Melissa Lem, we always appreciate your time and expertise. Thanks for joining us.
Thanks, Dan.